Hello, my name is Alex Misono, and I am an interventional radiologist in Orange County, California. My team and I have used the SinglePass electrocautery device many times with excellent clinical results. This video aims to highlight the best practices we have learned from that experience, and I hope this will support optimal clinical outcomes in your practice. My recommendations provide additional detail to the steps outlined in the product labeling. Take the SinglePass device out of the protective casing, taking care to gently remove the cautery needle. Remove the sharp stylet from the guide needle and place it to the side. Insert the SinglePass probe into the guide needle and connect the guide needle to the depth gauge. Adjust the probe until the probe is exposed at the same length as the biopsy sample length setting, typically 10 to 22 millimeters. You can use a sterile ruler to measure the distance if desired. To fix at your location, tighten the depth gauge. Then, disconnect the SinglePass depth gauge hub from the guide needle. You can now set the SinglePass device aside. We will not touch the SinglePass assembly again until we are ready to close. Perform the biopsy as usual, leaving the guide needle in place. You are now ready to switch on the SinglePass device. When you do, a green light will appear. Please remember not to activate the device until it is inserted into the patient. You are now ready for electrocautery. Advance the SinglePass probe into the guide needle. Here is a tip for optimal success. Using your free fingers, usually the index finger and thumb, screw the depth gauge onto the guide needle or needle shaft. Stabilize your hands by placing the fourth and fifth fingers on the patient's skin while keeping your index finger and thumb on the depth gauge or guide needle. This hand position maximizes control and allows for withdrawal of the entire system as one unit. Now we cauterize. Hold the cautery button for a minimum of 10 seconds to heat the device to nominal temperature, which corresponds to 18 green flashes. Continue to cauterize the biopsy site for a minimum of 10 additional seconds for a standard case or up to 30 additional seconds per operator discretion. We find that applying slight rotation to the probe will reduce the chance of charring and sticking. Then, start to pull back the device at a rate of 5 seconds per centimeter while gently rotating the probe. It often takes approximately 30 seconds to cauterize the entire tract and capsule. We will now take a moment to highlight the importance of a slow pullback speed during cauterization. These images from a porcine kidney cauterization study show that a faster pullback, in this case 7 seconds to heat and 7 seconds to pull back, results in a visibly smaller cautery tract. The optimal speed was actually 10 seconds to heat, 10 seconds to cauterize the biopsy site, and then a pullback speed of 5 seconds per centimeter. This timing results in complete tract cauterization. After tract cauterization, switch off the device. The entire system, including the guide needle and SinglePass device, can be disposed in a sharps container. The device contains regular batteries. Perform your post-biopsy imaging per standard, and you have completed another successful percutaneous biopsy with SinglePass-enabled biopsy tract electrocautery.